Hi, my name is Rebecca. I am a senior and I'm in Ryan Hollingsworth's internship class. I'm in my second to last semester at Malone, and so for my internship this fall, I have been working at Ortho United Spectrum Campus's therapy clinic. This is a therapy clinic that's in North Canton. It's located right behind Costco, so it's the big building that says Spectrum on the side, right behind the Costco building in North Canton. And then this is a photo of the inside of the building, specifically the treatment area. The occupational treatment area looks a little bit different, but the physical therapy area looks kind of like a gym with lots of exercise bikes and some treadmills and weights and stretch bands. And then it also has some beds, so that way they can treat the patients laying down or sitting up, reclined, things like that. So this is the mood board that I made for Ryan's class as an assignment, and I think it really captures all of the different experiences and emotions that I have about working at the clinic. So at the clinic, I'm at the front desk, and I also work as an aide that treats or that assists in the treatment in the occupational and physical areas. I primarily work at the front desk, where I'm answering the phone, scheduling patients, checking them in for appointment times and taking their co-pays, doing paperwork with them and going over their insurance benefits, as well as calling and scheduling prescriptions that we receive over the fax machine from the orthopedic surgeons on the other side of the building and from other therapy clinics, new referrals. So I'm just going to go through a few of these, kind of explain my experience. So firstly, this older couple here, the elderly couple, represents lots of the patients that we see. So many of the patients are 60 plus, and many of them even come together as couples, and we treat both of them. And so it's really sweet watching them come in, take care of each other, drive each other to therapy, wait for one another. And it's just been really cool getting to see relationships through so many generations. The name tags up here are also representative of how we are intentional in trying to remember as many patients' names as we can. Now, we see almost 200 patients a day, anywhere between 150 and 200, and that's a lot of patients. That's a lot of names, but they typically come 2 to 3 times a week. So it helps when you're seeing them multiple times a week to remember who they are. You see them as they're getting better, as they continue to be treated, or when they get a new injury or have a new surgery. You're kind of there with them through that process, checking them in every time. Now, we also experience a lot of multitasking, which may or may not really be a real thing if you can really be successful at doing multiple things at once. But this lovely yellow outfit woman here is having multiple things going at once, and that is how I feel every single time I'm there. I'm answering the phone, I'm checking patients in, I'm doing paperwork of things that have come over the fax, I'm asking and answering questions of people that are there. I'm being social. It's a very social environment. There are lots of people that work there and lots of patients that are always being treated. It's a very open area where you're always seeing, hanging out, talking to more people. It's not a restrictive and isolated environment. So going along with that, this colorful chat bubble photo really represents how you are constantly communicating, whether it's in person, over the phone, through written messages or email. You are always talking to someone and communicating some kind of information, which can be exhausting, but is also really good practice for communication skills. And then lastly, I'll talk about these little heart treats here, which represent the treats that the patients bring in. They not only recognize their therapist and their therapy team, but also the front desk administration, and they bring us little fun things too, which is really sweet. So a couple things that I've taken away from working here is that I have really been able to build on my communication skills. I am, like I said, constantly communicating, not only with patients who vary in ability, age, their injuries, but also with the therapist. So The patients are anywhere between 14 and 93 years old, and the therapists, there are about 30 of them. So there are 4 different teams with a supervising physical therapist, and then they have 4 to 5 physical therapist assistants that are on their team. So there's a lot of personalities and a lot of different communication styles that are required for you to kind of learn how to navigate when you're trying to communicate in a social, fun way, but also in a professional way. How do I communicate to you about your patient in a way that works best for you? Now, also learning the complex clinical software. That one is something that took me a little while. I'm still learning new things about it, but learning how the office, the software that the office actually functions on is critical to being able to really do your best job. And so on top of the social communication aspect, you really have to focus on learning the logistical software side to then be successful in what you're trying to do. And then lastly, I have learned how to schedule and assist in both treatment areas. So being cross-trained is something that they kind of advertised to me when I was at the interview for this job. And that's something that I really wanted to stick to, because the thought of learning not only just the front desk, but also being able to assist and aid the physical therapists and over in the occupational therapy suite has been really cool, because you can sense how you become a more valuable employee when you know more things, when you know how to do more, because then you can help and you can fill in and you can step up for those jobs or new responsibilities when you are eager to learn new things and when you're willing to jump into that scary part of being trained on something new, because then you have the advantage of having more knowledge, of knowing more. Lastly, the 3 takeaways I would say are the most important things I've learned from being in this internship would firstly be understanding the relationship dynamics in this type of setting and how they're crucial to knowing how to interact with others. So you have to be aware of the relationship dynamic. You have to understand how other people are interacting with each other. So on each of the 4 teams, they have very much their own dynamic. How they work as a team is different. And if you tried to mix people up and put them on new teams, you would have insane dysfunction, right? But because they've figured out how to work together, and then such as me being a little bit of a floater, an outside person that does a little bit of everything, I have to figure out how each team works on their own, and then how can I help, or how can I understand this function? So that goes for any workplace, understanding where you fit in each of the bubbles, each of the societies, the communities within a larger workplace, and then how do you fit into that, and what role do you play? It's also important to note the intentionality can really make or break a patient or customer experience. So the fact that we are so intentional with patients in contacting them multiple times to schedule, to reaching out to them in multiple ways, answering the phone, answering the phone a major priority when they call, and returning their phone calls, as well as greeting them when they come in and remembering their name when they come in to be a patient multiple times. That intentionality, that effort that they see in us as staff is really impactful to them, and that makes them want to keep coming back, and that makes them tell their friends that they should come to this clinic too. And then lastly, the fact that communication is constant is something that everybody should be aware of. No matter what setting you're in, you will always be communicating all the time. And it may not be to the extent of this environment because it's so highly social, but no matter if you're talking on the phone, even writing, I write notes all the time to people for later. I leave them somewhere, they're on the papers I'm putting in certain spots. And so those notes, those written messages, is communication to people later on. When they find those, they'll be like, oh, Rebecca's communicating to me. So it's really important to know all the different ways you're communicating, even with your body language, your behavior, the way you are presenting yourself, your posture, how quick you are to volunteer for things. All of those things communicate something to everyone. And no matter where you are, people are always paying attention to you. in some way or shape or form. So you will always be communicating to someone. And so just remembering that is really important. So these are the key things that I've learned from my internship at Spectrum Therapy Clinic. I thank you for your time, for listening, and please don't hesitate to reach out if you have any questions. My email's here, rbcooley1@malone.edu, and I'd be happy to answer any questions or assist in any advice I could offer. And I really appreciate you taking the time to listen. Thank you.